Hello, I'm Jonathon Collopy, Executive Director with the YMCA of San Diego County. This is YB Well. And in honor of World Mental Health Day, we're having a wonderful guest with us, Dr. Willough Jenkins. Dr. Jenkins is UCSD Associate Professor of Psychiatry, specialization in youth and adolescents as a psychiatrist. We're going to talk about what's going on in the world and how we can best meet it at this time. Dr. Jenkins, nice to see you again.
Oh, thank you for having me back. And what a timely conversation.
Yes, it has been a fascinating ride of late in a lot of different ways. And I know a lot of us are challenged greatly in terms of our overall well-being. And I know the whole idea of having good health, mental health is a critical aspect of that. And I just want to start off with, from your lens, why is the world so overwhelming right now?
Oh gosh, there's so many factors, but I think first off, acknowledging that I think almost everybody is experiencing this and feeling a little bit overwhelmed by the news, by the different priorities and different places we're all being pulled into. The obvious is, of course, what's happening in the news and the fact that most of us carry around phones and have constant access to news at all times. And so it's really hard to turn it off. And, unfortunately, there has been some very upsetting news for most people, as of late, and finding a way to take a break from that can be really hard because there's this pull of wanting to be informed and stay updated, and yet also needing to take a little bit of space emotionally to allow us to process and to rest with that type of information. So I can definitely see that being a really big factor contributing to the overwhelm. I think the other piece, which is always kind of close to my heart, is thinking about families. And there are so many kind of pressures on families at the moment. Here in San Diego County, we have such a high cost of living, and so many families are working multiple jobs or trying to do different things to provide for their family and, also be present for their kids at the same time. So when you have that kind of underlying kind of overwhelm already within your life, then you add in, other factors like news and things that are happening in the world, you really can put yourself to a bit of a boiling point with feeling overwhelmed.
I can use myself as an example. I love to be updated, and I don't really look at things throughout the day, but I love to come home and get updated on world news, local news, and be literate of what's going on in our community. And as of late, at least on the world news stage, I've had to turn it off because it's too much. And we're missing a lot of those humanitarian positive stories. And I know they're out there, but they're being overshadowed by really the plethora of negative doomsday newscasts, so to speak. So with such saturation in terms of the news, how does that affect us physically, mentally, emotionally?
Yeah, I think it absolutely does have effects in all of that way. And I think you raised a really important point about being so much of the news that we consume and that we see does have a negative slant, and unfortunately that's because that's what gets more attention and more clicks. And reminding ourselves, like you said, that there are people in helping roles, there are people very much taking action can really help. It takes a little bit more to seek out those stories, but they are out there, and that can be really helpful so you don't feel so hopeless in some of these situations when consuming this type of news. Obviously, when you do feel overwhelmed, though, it can make an environment in your mind where you feel more stressed, you're more on edge, you're more irritable. It's harder to take in additional information. And many people tell me that they find the place that they kind of take it out on or feel more irritable is kind of at home, and find that they might be more shorter with their partner or with their children. And that's where they see the real effect, unfortunately. The other piece, of course, is when you're feeling any type of kind of chronic stress or overwhelm, is it does affect you physically. You may be more prone to headaches, stomach aches. These are all very common experiences. And, the one most people tell me, though, is that their sleep's impacted. So even if it's not that they're staying up late looking at their device, consuming all of this stuff that makes it hard to fall asleep, just being in that state of kind of chronic stress impacts your sleep. And then when your sleep goes, It affects mood, anxiety, really all of your mental health. So that's one of the areas I like to target first when people come to me talking about feeling that overwhelm or that stress is, okay, well, how can we really prioritize and get you sleeping and make sure that that's at least a fundamental piece that's in place.
So some of this, it sounds like, is very understandable, even though we're not directly experiencing some of these events that go on. So you've given a context that it's understandable. We may not even recognize that we're short with people and recognize that we're that lack of sleep over time. So, Dr. Jenkins, I think of, at times of overwhelm, I may not be as aware of how I'm coming across. And I think that might be true for a lot of us because we're just captured by our experience. And so, how do we raise that awareness so that we are in a place to then seek support, resources, a way forward?
Yeah. Well, I think the ideal is if you check in with people close to you, and honestly, all of us have been living in this environment. And like, how do you feel like I've been doing? That's a really reasonable question to ask people that are close to you in your personal life. The other piece, though, like I mentioned, is there can be these kind of like sneaky signs that things are starting to slip. Like if you notice, gosh, it is taking me a little longer to fall asleep at night, or I'm really not staying asleep as well as I used to. My appetite's changed. I'm just feeling, more tired. I'm having a little bit of more difficulty focusing at work or at school. Like these are some of the subtle signs that are early signs like mental health things are starting to creep in. So I really love educating people about those so that you can kind of be more mindful and, take a week where you start to track your sleep or take a look at your energy level and how you're doing. And then kind of reevaluate and maybe talk to people close to you about how they feel you've been. And that can be a really nice way if you're not fully aware of how things are impacting you to get a bit of a read.
Great. Very helpful. I appreciate that. I was reading World Mental Health Day from the World Health Organization. There is truly a focus on humanitarian emergencies. And I know a lot of us aren't directly experiencing that, but there's a vicarious experience when you see it in the news. And so from what you've said earlier, that's understandable that weighs on us and has an impact on our mental health. But I definitely have compassion for those that are in those situations and truly the constant exposure to the events of the crisis. And so I just wonder your perspective in the world when people are in such situations where maybe they've lost their homes, lost family members. And so if you can give, context for that on a world stage.
Yeah, no, absolutely. Some of the events that are happening in the world right now, whether it's areas that have conflict, really are quite horrific and very hard for any of us to comprehend. It's important, though, for me to also acknowledge, though, we do have our own crises happening here. In California, we have wildfires, we have floods, we certainly have emergencies and situations that are happening here as well. So for some people, it definitely may hit, much closer to home, or having heard about these events may impact them differently because perhaps they've gone through times in their own life, where they'd fled conflict or, they'd immigrated from other places. And so then the impact that hearing these stories has on them is going to be much different than for somebody else. So we're all very in how these different news pieces, do affect us. And I think one of the best things, like we were talking about, is for anybody who is touched by some of these stories is thinking, how can I convert this into action? How can I help? How can I take this information in and focus on, oh gosh, all these amazing organizations who are trying to help. And I mean, I emphasize that because that's specifically one of the best tools for young people and for children who, maybe it's the first time they've heard of events like these and they're processing it. And how do you go to sleep at night knowing that these things are happening in the world that we live in, and trying to bring those messages of hope is really a great place to kind of land and try to keep your focus on when all of these things are happening.
I appreciate you going there very much, because even more recently, I'm hearing a lot more of the narrative of this sense of helplessness, hopelessness, and even, a sense of guilt because I'm maybe not in that experience and I don't know how to help. And so I appreciate that perspective. So where are we finding that would you say that hope of the way forward?
Yeah. Well, I mean, for a lot of us who've lived through, periods of time where we have the experience to look back and go, gosh, there have been conflicts and, we have come through them. Looking at history, there is a lot of hope when we look back on past events to draw upon. It's very hard though in this moment, and especially like I say, for young people who don't have that experience to pull on, or maybe haven't read about some of the things that have happened within our history, to be able to pull on that to find hope. But I really think that finding anchors on the organizations that are doing charitable work, the people that are going in and dedicating time. I'm in healthcare, so finding the healthcare workers who are working tirelessly to provide medical care. These are the stories that give me so much hope that things will get better. And there's also a lot of young people, advocating and adding their voices to the conversations and advocating for change and what they feel should be different. And as someone in a different generation, I find that so very inspiring, and that brings me a lot of hope when I look at world events. So finding those type of voices and stories, and like you mentioned, they do require a little bit of seeking out, because unfortunately that's not always what people click on, and then that news doesn't get amplified, but that can be really helpful in setting it as a priority.
I love what you brought forward, because we need light in the world, and I appreciate how you've highlighted the youth that are coming forward, young adults, and really their passion to make a difference, their example to be part of community and bring others along. So that is beautiful. So I look forward to more of that being amplified. If I could ask you, if I could tap your expertise truly, in terms of giving us other tools for our toolbox to deal with overwhelm, and if there's an array of different things that we should incorporate as we recognize the need for such.
Yeah, there's so many things you can do, but a couple that I think are really universal is stay connected to people, especially with news and things coming through our devices. It's easy to take it in and forget to talk about it. So I really encourage, like, if you're seeing something or something particularly is causing you distress, do talk about it, whether it's with your partner, with friends, even with colleagues at work. Make sure you're not isolating with that knowledge. And just staying connected socially is so good for everybody's brain, regardless. So that's just kind of like a basic preventative piece.
Great.
For most people, when they're experiencing stress or feeling overwhelmed, exercise is so key and so helpful. And as you certainly, with the YMCA, there's so many amazing exercise and group programs and ways to get that social connection, community connection, and exercise built in. So accessing anything like that is just such an amazing resource to help when you're feeling stressed and overwhelmed. We know exercise just has amazing mental benefits. So that is, that's definitely kind of a key recommendation as well. And of course, I always have to plug the professional resources, because when you are struggling and it's starting to impact you, and maybe you're not able to do the things you wanted to do, you're not finding joy in the things you used to enjoy because you're feeling this burden of overwhelm or stress, it's really important to make sure that that's not crossing into actually experiencing depression or another type of mental health condition where there is treatment and there is so many things that we can do as professionals to help you. And it's always okay to go to your doctor or to a counselor and just ask, like, do you think I'm dealing with this appropriately or not? And sometimes people will say, yes, I think you're dealing with that appropriately. That's understandable. Come back and check in 6 months. Let's make sure things didn't get worse. Or, you know what, I actually think this has crossed into the place where we should really be talking about getting professional treatment and help for what you're experiencing.
That's really important, to get that objective lens. And sometimes those closest to us will say, you're good, you're doing fine. And maybe those around us are also challenged in particular ways too. And so to get an objective measure, because a physician, a mental health professional, they will ask questions and have methods to really get a check-in in terms of how one is doing in a 360 perspective. So I appreciate that. If you will, mental health, and when we're talking about humanitarian crisis in the world,
Yes.
what is the emphasis on mental health? I think of, there's basic needs that often need to be met, food, shelter. Is mental health becoming more prominent, or the recognition for, I think of areas in the world where there's the constant fear of death and death all around, and how we can be compassionate neighbors, so to speak, and just wonder about the incorporation of mental health resource.
Yeah, well, mental health is being recognized as a universal human right, and so it's something that's at a priority for most like worldwide organizations, including the World Health Organization, including most policies that are looking, in countries that are more resource poor, in really prioritizing access. And so it really has become an increased focus, which is amazing because it allows for a lot of opportunity of people to provide education and more resources, but also importantly, to learn from each other and to learn from places. I was just speaking to somebody earlier today about how it's very important that we don't think that just because here, in a Western country, we have all the answers or we have all the solutions to mental health, because it's actually quite amazing what other people and other countries and other cultures are doing to approach mental health. And so we equally can learn as much from places as, we can impart our own resources and wisdom too, in a sense. So I want to really emphasize it is a two-way street, but I really appreciate that there's a lot more focus and resources being given to support the mental health in so many places worldwide. Obviously, it's so needed.
Wonderful. If, for those that are listening, is there resources online available? I mean, we talk about social media and the bombardment. My assumption is there's a wealth of resources out there as well that we can tap into.
Yeah, well, I think speaking about the worldwide issues and the humanitarian crises, I really encourage anybody to go to the World Health Organization website. There's amazing fact sheets, ways to get involved, ways to help, educational resources. So that's an amazing starting point for anybody wanting to look at things on more of a global level and being a little bit lost at where to start. They have a wonderful resources there. For more close to home, I think it's important to also recognize we do have, amazing resources through the Mental Health Alliance. NAMI is an amazing organization, our National Alliance for Mental Illness, that provides excellent supports and peer supports. There's really so many resources, to be quite honest, but I also recognize how overwhelming that can be to figure out where to navigate. So for a lot of people, I say, if you're concerned, the best place to start is with your primary care provider. Go in, have an individualized conversation with them, and then maybe allow them to direct you specifically to places to get information for what you're going through, and also local to San Diego can be really helpful too.
Wonderful. I appreciate the various contexts that you've provided, kind of grounding us in that we've been through challenging, difficult, worldwide crises of prolonged nature and have come through that. So we have a historical context that we are going to get through that. Also, you've spoken to when there's that tipping point when we recognize that we're tapped, we're not in the best mental health resources out, how to recognize that, how to get a fair assessment, as well as various tools that we can add to our toolbox as we move forward, and just the compassion on a global scale in terms of what's happening in the world, and the recognition of how we might be able to get involved and support in a broader context as well. What else, anything else that is important for us to talk about today related to World Mental Health Day? And just, I appreciate that there is such a day to give acknowledgement to world health in a larger perspective.
Yeah, well, I always say mental health conditions are medical conditions. They're not a weakness or a character flaw. We have incredibly effective treatments. And for most mental health conditions, recovery is the rule, not the exception. So I am someone who works with mental health every day, and I have so much hope because I have the benefit of seeing people get better and thrive. And that's the main message I really want people to hear, is that there is so much hope for recovery, whether we're talking about mental health or if we're talking about things on a global message, on a global level. I feel that that's really important. I think some of my optimism, though, really comes from listening to young people and to being kind of centered in spaces where they are. So for anybody listening who doesn't have that opportunity and maybe is feeling a little bit down or a little bit hopeless, I encourage them, if you have that opportunity, sit with young people, hear what they're saying, and you probably will leave feeling a lot more hopeful and inspired than you'd anticipated. Our young people are amazing.
That is very true. I have that opportunity. I'm surrounded by young professional, young people, from preschoolers all the way through, which is wonderful. It's vibrant.
Yeah.
and it's promising and optimistic. Any insights that you can share in your life that you utilize to maintain mental health that we might be able to learn from?
Oh gosh. Well, I never pretend to be more of an expert. I have some knowledge and I do my best. I try to spend as much time as I can with my family.
Mm.
And I find that that is really what grounds and resets me and helps me prioritize what's really important. I also, as many of you, feel so lucky to be living here in an amazing county where we have such access to nature. And, when I can, I try to get down to the beach. There's been some beautiful sunsets lately. So yesterday was a busy day. So I just went down with my daughter and we sat and we watched the sunset. It was 15 minutes, but completely reset and was a wonderful thing to do. So those little moments really add
Yeah.
up.
Yeah, the joy that comes from that definitely fills our cup again. Thank you. Dr. Willough Jenkins, thank you so much for what you're doing in our community in San Diego. Also, just the work that you're doing. I know you do work throughout the United States, bringing your message forward of mental health and also the work with the World Health Organization. Dr. Jenkins, a pleasure to be with you. Thank you.
Thank you for having me.
Always a pleasure. Those listening, please be well until we have the opportunity to connect again. Thank you very much.